this, which really is not causing any pain to the child, does not, it's non-invasive because you can remove it easily for hygiene, to shower, but they do need to wear it 23 hours a day. And really does not cause any pain because we're not looking to create pressure to the growing brain. On the contrary, all we are doing is just holding the device onto the bigger areas of the head, providing space to the areas that are flat so that the new growth can actually be directed to that area, creating the rounded skull that is desired.
And as I'm sitting here, and you might want to correct me, but it's almost, in a sense, brain orthodontics.
It is.
Exactly.
As I'm looking at it, because what it really is doing is it's, as you stated, it creates a not only protection, but more importantly, it creates enough, I guess you could say, direction by pressure. So that the brain and the skull will grow more naturally.
The only difference, though, that I could probably interject
Sure.
there is that with orthodontists, you're really creating tension
Yes.
to the teeth and sometimes provoking a little bit of pain. Here, we don't produce tension. We provide actually the space, and it's a constant. The area of holding is constant. It's never increased. So the child never goes through any pain or discomfort. We're not creating any intracranial pressures, which are dangerous and undesirable. So it's the areas of hold are always the same, opposite to orthodontists. But the growing brain just is directed like a waterfall to grow into the area where their flatness is creating the rounding.
And I would assume, and again, it was just an off-the-cuff thought that hit me intellectually, but in what I would assume, as listening to what Dr. Stelnicki said, is that giving the brain the opportunity to grow to its true capacity certainly enables the child to be able to have not only the intellectual, but the neurologic responses that are what we call normal to this child growth. Is that correct?
Exactly. Yeah, you can only imagine that the brain was made to be symmetrical in all lobes. You know, the frontal lobe and the occipital lobe was made to be the same size. And you can only imagine what could happen if one becomes larger and the other side flatter, creating the asymmetry. So yes, we are really creating a better functioning brain like it was intended to be.
Dr. Stelnicki, I would assume that a good part of the cooperation and collaboration with Ms. Camargo relates to directions that come from either yourself and or your colleagues that are involved, because I would assume that there is some indication of maybe some neurologic potential or some other potential. Should help me out with this?
Oh, absolutely. The use of this molding helmet is yet another example how we can make surgery better by going beyond the surgeon himself. We have now become a leader in minimally invasive skull surgery for kids, where we're making incisions this big to go in and completely reconstruct a child's skull. We developed most of that techniques and instruments here in the Craniofacial Research Lab through donations to the dental school that helped fund it. And these molding orthoses allow us to reshape and redirect the healing process in a way never before imagined. So before, we would have to make an incision all the way across someone's head and get in there and completely reshape the bone, putting in countless numbers of screws and metal plates and things in order to hold the bone together. Through working with talented occupational therapists like Ari, who understand these custom-made molding orthosis and how to tailor them to each patient, we can now be minimally invasive, and she can produce a skull that's even better than what we could do surgically through this post-operative molding process. And we have scars that are that big that you can't even tell that the child had surgery when we're done.
Again, I'm going to get back to, if you don't mind, Ari, because this, to me, the staining of a child by the viewing of a child almost to the point of, and I hate to use this phrase, but I'm going to use it anyway, because I said this to you in the very, very beginning, Dr. Stolnicki, when you and I met many years ago, that I'm sort of tired, me personally, I was sort of tired of people looking at children and saying they look freakish.
Right.
It's unfortunate.
Yes.
They're great human beings who, by the cause of some event in the pregnancy or through some gene changes or something that caused these, what we would normally say as general viewers, unsightly or untenable views of a child to make them look, oh, I don't want to see that.
Right.
When the truth is that you and your teams and all the people that are involved create a new life, not only for the child, but for the viewers, so that they can understand that they're really, these young people, these little children, who through no cause and effect, usually on their part, can be helped.
Oh, for sure. Well, you know, we as humans are a very visual and audio centered species. And we do respond to visual stimuli and audio stimuli. And if a child looks different, or if a child speaks different than other children, they become socially outcast in some ways. We work incredibly hard to eliminate those stigmata. And the best compliment we can get from a family, and I've had this a few times, is a child afterward who they say, nobody knows my child ever had surgery. Even children who were born with very wide open clefts, very big facial scars, very deformed skulls, we are able to frequently get them to a point where I've even had to talk to families and say, you need to tell your child they had surgery, because families won't tell them, which is a compliment. If you can get to the point where you don't ever have to tell your child that they ever had a problem. But you know, someday they'll ask, and someday, and we're always the honesty is the best policy thing. But kids we've gotten to the point where literally kids will go to school and their friends will be with them for years and never notice that they had a facial deformity.
Well, as you and I discussed, we all three of us discussed before the show, that the kind of dedication that you offer, which is really, it goes for long periods of time. It isn't like a surgical procedure, then you hand them over to Ari, and then she does her thing, and then, no, it goes on and on and on and on.
Absolutely.
So it must be the series of contentments, professional contentment, I would assume must be dramatic for you.
Oh, it's wonderful. And it is a different type of plastic surgeon. I mean, most plastic surgeons see their patients once or twice and then they never see them again. If you go into this branch of plastic surgery, you have to be committed to almost being like a primary care doctor in many ways, that you're going to follow a patient throughout their entire childhood and adolescence and into early adulthood and be there for them. And you have to become like someone's primary caregiver. You have to become part of their family and be with them when they're growing and things are changing, and you have to learn how to structure surgeries based around their developmental needs. And those things take time, and it's not for everybody. Some people don't want to follow people for years and years and years, but for me it's very gratifying, and I get a lot of hugs and get a lot of thank yous, and I've made a lot of close relationships with a lot of families over the years, and I'm grateful for those.
Well, let me just say this. In behalf of my viewers, we're going to give you a big hug, and we're going to give you a little kiss. All right?
Well, thank you. I'll
give
take
you a
them.
big hug.
Those
and
are the
kiss.
best.
All right. Ari, let me ask you, where are you located? You're located at Joe DiMaggio?
No, the practice is off of Las Olas in Fort Lauderdale.
Oh, okay. Well, tell us where.
It's on 15th Avenue and 100th Street,
Right.
a block off of Las Olas Boulevard.
Okay, so, and I would assume you, as any health professional, you receive referrals?
Yes, the child.